If anybody needs an eye exam, I've got a chart right behind me.
Can you just do it from here? Can I just read those off to you?
Well, we'd have to work on some laws, but I think they're working on teleconferencing, so with
You gotta do what you gotta do.
telemedicine, we'd have to arrange to make sure those are just perfect for you, though, from the screen. I'm sure that could be interesting to try to figure out. I would need somebody with, no, more math experience, Brian.
Well, I was just telling, I had a little work meeting before this, and I was telling him that time is just traveling so strangely right now that I change out my contacts every 2 weeks, and I never write it down. I always just remember when the day is to change them out. I've never written it down in my life. And this week I was just like, I have no idea when I changed my contacts last. Like zero, absolutely not even a ballpark idea of when that last happened.
I guess you're going to have to add it to your calendar.
I know I'm going to have to, but I was always so proud of myself for just remembering it in my head. And
well, that's because you figured it out. It's part of a routine that you do. And right now there is no routine.
Yeah. Anyway, I went ahead and changed them. I don't know if I changed them too early or too late but
well, I'd rather that you changed them too early.
Okay. It's good advice.
We want to keep you healthy.
I'm trying.
Mr. Bach, are we ready to roll?
Mr. Mayor, I believe we have all the commissioners appear to have signed on, and I believe everybody with the speakers are present and ready to go.
Okay, thank you. All right,
Can you hear us?
I'm sorry.
I think they're trying to do a sound check from the health department.
Okay.
Go ahead.
Can you hear us here at the health department okay?
Yeah, that's a lot better than you were a little bit ago. Great.
Okay, good.
All right. Thank you. So I want to announce that due to COVID-19, we have individuals attending remotely. All participants joining by phone should mute their phones when not speaking to avoid background noise. And during the meeting, please make sure that you announce yourself by name and title every time you speak, so the public that is participating knows who is speaking. This is critical given the number of remote participants and his current guidance from the Kansas Attorney General. Now call the meeting to order. I ask the clerk to announce the meeting and call the roll.
A special session is being held on Thursday, May 14th, 2020 at 5:00 p.m. for the COVID-19 update, economic development incentives report, and a priority-based budgeting report. Roll call. Walters.
Here.
Philbrook.
Here.
Bynum.
Here.
Burrows.
Here.
Townsend.
Here.
McKiernan.
Here.
Ramirez.
Here.
Johnson.
Here.
Kane.
Here.
Markley.
Here.
Alvey.
Here. All right, thank you. As noted by the clerk, we have 3 reports. Our first is a COVID-19 update from the health department. Turn it over to staff now.
Thank you, Mayor. I will start with the introduction. I think as we moving forward to this week, there are several things that we're hearing from the public on, and that's really as our update plan is out there, people are looking through, asking for some in different interpretations, which we're trying to provide to them. So the health department will not only be giving an update about status of things, they'll also be talking about, different things as we move along, as we're in the red zone right now, and we'll be there. Like many businesses in town, the unified government operations, we are operating in the red zone, red too, based on how the revenue projections are moving along too. But just to go with that, we're looking at we will open up when we move to yellow. And I think that's something that many businesses are anxious to find out, but we're not in that point of being able to give dates, but the health department's going to explain a little bit about that. I do want to make one announcement as we are moving forward before I turn this over to them. Today, I announced that we appointed Julianne Von Loo as the new director of the health department. So she will be making her first official presentation in that role. I certainly want to thank Terry Garrison for her service as she serves as the interim director in this position since the departure of Terry Reckhausen end of last year. So thank you for your great work, Terry, as you've led up to this point. And I'm excited to introduce Julianne to lead the presentation tonight. With that, I'll turn it over to the Health Department.
Mr. Mayor and Commissioners, we're going to really keep our presentation tonight pretty straightforward. We're going to talk about the data that we're seeing and monitoring, and then the phased reopening and what we're using that data for. Go ahead. Okay. So a quick look at the overall numbers. Again, we want to point you to the rate per 100,000. We're consistently higher than our surrounding communities. I think the really interesting thing and the important thing to know this week is that the Kansas numbers statewide continue to climb. Many of you have probably seen that the governor is moving to phase 1.5 rather than moving from phase 1 to 2, and that's a lot to do with the Kansas numbers statewide. So we're keeping an eye on those. Obviously, we don't live in an island, and it's not just the KC metro area that affects us, it's the state as well. So we're keeping an eye on that. And we talked last week a little bit about rolling averages. So each of these points on this graph represents the average of the previous 14 days. And so when we look at this graph of new cases and the rolling averages over 14 days, we see that there does appear to be somewhat of a plateau. We're staying cautious, but overall, we're plateauing to some extent. There is unfortunately one caveat there. We are seeing now a little bit more of a delay in our test results as we've switched to laboratories to get currently free tests through the KU lab rather than a previous lab we were using that had a little bit quicker turnaround time. So we're 2 to 3 days behind on our data right now, and so I just want to make sure folks know that. But overall, we seem to be plateauing to some extent. When we switch to deaths in terms of rolling averages, we are certainly seeing a nice downward trend. Obviously, we're coming down from those higher numbers we saw related to long-term care facilities, and even though our positivity, our positive case number has stabilized and not declined as much, this is a good sign. Obviously, we think the disparity here is that the cases that we're seeing now are largely linked to workplaces and outbreaks, where there's a significantly younger population that's being infected, and fortunately leading to fewer deaths. But the lower deaths does not mean that we're not still having high numbers of cases. And then the other thing we would point to is the percent positivity. So this is on any given day, obviously the number of positive tests over total tests performed that day. So we're also tracking this carefully. You can see there's been quite a bit of variation over time. But similar to the other metrics, it does look like there is at least a plateau or a slight downward trend. We're cautiously optimistic is what I would say. We are doing a little bit more testing of asymptomatic folks as we identify those folks quicker. These are folks who have been exposed to someone who is known positive. So we're testing more of those folks, and when you test more people, obviously that can change your percent positivity rate and bring that down a little bit. So we think there's some attribution there. And then we also wanted to call out our positivity rate specific to our pop-up sites. So many of you know we've been working hard with our friends in the Health Equity Task Force, as well as Vibrant, who's taken a lead on a lot of the pop-up testing in the community, which has been going over very well and very positively received. You can see here the various sites over the last 2 weeks or so. And again, if you look at that right column, the positivity rate does appear to be going down. Again, they are doing some asymptomatic testing. They're not fully testing anybody asymptomatic who wants to walk up. But again, a lot more of those contacts of positive cases are being tested. We attribute some of it to that. But overall, it's looking fairly positive. That's a lot of the data that we're looking at to make our decisions as we move through this phased reopening. And I'll kick it over to Dr. Corvo here to talk about that.
Hi, everyone. Good evening. This is Erin Corvo. I'm the Deputy Health Officer here in Wyandotte County. I wanted to start out here and then show some of the most frequently asked questions that we're receiving via our website and also via the 311 line. And so one of those here is, when is the earliest we'll move to the next zone? We're going to be in the red zone for at least 2 weeks. And that would be the least amount of time that we would spend in any given zone. We may have to pump the brakes and stay in the red zone for longer, or even stay there for an extended period of time. We've decided within the health department here that we'll make a decision by Thursday, May 21st, as to which zone we need to be in, if we can graduate onto the yellow zone, or if we really do need to stick around in the red zone. We're also getting a lot of questions about guidance for salons and barbershops. I think everybody's hair is getting a little bit long. And so that would be in the yellow zone. We feel that it would be safest to open those. We're also getting questions, especially from businesses, as to if we have masks available. We're working very hard on a daily basis with emergency management and others on obtaining masks. We're really trying to prioritize those workplaces that have experienced outbreaks. Today, we just received thousands of masks from a donor. They're cloth masks, so that has been really great, and we'll be able to distribute those shortly. And then we're getting a lot of questions about the summertime pools and water parks and such. Near the end of our presentation, Emmerich Cross will be able to say more about that. And with that, I'll turn it over to Dr. Greiner to continue our discussion.
Thank you, Erin. I'm going to move the mic a little closer here. We're trying to distance as best we can, but we've got new camera equipment here. So what else is important about changing zones? As Julianne mentioned, we're watching that data on hospitalizations and deaths. We're doing the 14-day moving averages, but we're still wanting these decisions to be weighed over the full 14-day period, which is the sort of known longest incubation period for this virus. And so we'll continue to do that and continue to update those graphs every single day going forward. We'll also be watching that positivity rate of testing, both with the pop-up sites, like in the table that we just showed, as well as the overall positivity rate for the county. We do believe we'll be able to test more of these close contacts of known positive cases that are asymptomatic, and by doing that, we probably will get the positivity rate to drop. We also have some information that Heart to Heart International is starting to launch various community testing efforts all across the Kansas City metro area. Some of those will be in Wyandotte County, and they're pretty eager to work with us on that process. And in fact, they are starting that by wanting to test as many asymptomatic first responders as possible. That will probably also lead to more negative tests that will drive our positivity rate down. But it may lead to, it will lead to certainly some positive tests as well. And then we'll have to do all of our contact tracing on anyone who's positive, even if they're an asymptomatic positive. And so, as you can imagine, we're sort of ramping up and continuing to sort of plan ahead for how we will do all of that contact tracing work. I think we want to get that point across, and Mayor and I had some discussions about this earlier in the week, that testing goes hand in hand with contact tracing. There's really the value of the testing is only there if you've got the ability to follow up with those people, find out who they've been around in the days prior to illness development, or if they're an asymptomatic positive, it could be an extended period. You're wanting to find out who they've been in close contact with. Call all those people, do the education on the phone to get those folks to quarantine for the 14 days. And then, in some cases, follow up with some follow-up phone calls later as well. And we'll be continuing to work on those protocols and having the best system in place that we can to limit spread. We mentioned here at the bottom of the slide, having this diagnostic capacity. We want it to be rapid, so we're going to keep pushing hard to try to get the turnaround time on the lab test as close to 24 hours as we can. That we've lost a little ground in that in the last week or so, and so we're going to push hard. And of course, we have to have the healthcare facilities. We feel like there is pretty adequate capacity in most of the facilities in the metro, although many of those facilities are now beginning to do more of the cases they were putting off, surgical cases and procedures that end up leading to multiple day hospitalizations. So they won't have as much surge in the coming weeks. So we've got to watch things closely. We've already mentioned the protective equipment and the tracing. So we'll go to the next slide. And I believe this one we can turn over to Emmerich Cross. Emmerich, I think you're there.
Yes, Dr. Greiner. Thank you. Good evening, Mayor and Commissioners. Tonight I want to talk about two quick items. The first item is we've created a recreational subcommittee in Wyandotte County for the governing entities such as the Unified Government, Bonner Springs, and Edwardsville. And we've also included the school districts in our county, USD 500, Turner, and Piper. And we've created this recreational subcommittee our goal is to create some guidelines for summer sports. It's starting to get warmer consistently now, and we'll have people wanting to practice. And we wanted to make sure we had good guidelines and health measures for those summer programs that wanted to not only practice, maybe eventually play games. So we're looking at creating some guidelines such as things such as social distancing and other sanitizing and safety measures that we'll implement in our program as well. And we'll report back to the commission on that. Our first meeting is set up for Tuesday at 2 p.m. with all of those other organizations. And I think we'll have some good recommendations and guidelines coming out of that committee. The second big item I'd really like to talk about is Parkwood Pool and our spray parks in Wyandotte County. These are the public pools. I want to make that distinction. Last Friday, we had a really good meeting with Commissioner Townsend, Commissioner Bynums, myself, and Angel Aubert with Parks and Rec. And we had a great discussion about our summer pool and spray parks program. We have one public pool, Parkwood, and 3 spray parks in Wyandotte County in the unified government system. And our main discussion obviously was COVID, but we also talked about lifeguards and our lifeguard pipeline system we're trying to create here in Wyandotte County. As for lifeguards, we started out with putting job applications on the board. And before COVID hit, unfortunately, we didn't have any applications turned in. And then when COVID hit, it really interrupted the application and recruitment process for lifeguards. So we have 0 lifeguard applicants to this point, and that really disrupted that system. It takes about 4 to 6 weeks to train lifeguards, and that's a very long and intensive training program. We want to make sure everybody's safe and they're adequately trained to rescue children and others. But the other challenge we have is the school system have closed down their pools. And before I get into that, I'd like to say that Commissioner Townsend and Doug Bach and Angel Aubert met with USD 500 to acquire use of their swimming pools to train our lifeguards. And we had that in place, but once COVID hit, that also closed down the school pools. So we have nowhere to train lifeguards, and that's a big problem. Now, as for COVID and the unknown future of the virus, and if we do have a second wave perhaps, or the unknown status of what this will bring us in the future, our team that met felt that social distancing at a pool and spray parks is really unrealistic for children. You know, kids, when they go to the pools and when they go to spray parks, they're constantly tagging each other, playing games such as water tag and things like that. Kids go there to have fun, so it's natural for them to have a lot of contact with each other. So we decided as a team, we didn't really want to open Parkwood or spray parks and put it out there that if it was open, that means safe, especially for the children. But we do know if we didn't open the spray park and the pool this summer, that everyone would be safe because there'd be no opportunity for the virus to be transmitted and spread. So after consulting and talking with Dr. Greiner and our medical team, we decided to close the pool and spray parks for this season. And I would like to point out that many pools and aquatic parks in our region have already closed, including the metro area. And I would also like to point out that Bonner Springs has already closed their city aquatic center and pool as well this year. So out of abundance of caution this year, we decided to close the pool and spray parks and just play it safe with our citizenry and especially our children. With that being said, Mr. Mayor, if I can at this time, I'd like to turn it over to Commissioner Townsend for a few comments on this issue. Thank you.
Thank you, Mr. Cross. Mayor, Commissioners, Mr. Bach, and to the community. I wanted to say a few words because I wanted the community to know that this decision was not taken in a vacuum, and that our paramount concern always, every summer, and will continue to be the safety of the kids and the relatives and the staff who frequent our pool. I look forward to every summer going to Parkwood. I'm there on average 3 or 4 times a week to see what is going on, how our kids are enjoying it, what staff needs. So this is something that I will miss. But having said that, I can paint for you and hope you can visualize what normally goes on at a swimming pool. There's a lot of contact. There's no way, practically speaking, that we could enforce social distancing or ask our lifeguards to do that. Their primary job, of course, is aquatic safety, but we could not ignore any aspect of safety to our kids or staff. You heard Mr. Cross say, we have been for the last several years, it's been a priority for me to increase the number of kids who can become lifeguards. We've seen that number shrinking over the last several years. So that's a serious challenge. We need anywhere from 10 to 14 lifeguards per year to safely staff up. We may lose a couple over the summers. A lot of these kids are returning lifeguards. They're now in their 2nd or 3rd year of college, and I'm appreciative to every one of them that I've met over the last 7 summers who have come back. So there's a normal turnover, but this year, the presence of COVID may also have impacted those kids who would otherwise be inclined to sign up, even if they don't know how to swim, and get training to become lifeguards. So even if we had lifeguards available, it's going to take us 4 to 6 weeks to train them. And that's going to erode significantly into the time that we have for the pool. With the schools, USD 500 particularly, opening up earlier over the past years than has in previous years. Last year it started, I think, around the 8th of August. Our pool time is short because even then lifeguards are going back to school. So that in and of itself, the lack of lifeguards is a non-starter for safety reasons. What our group would like to do, and what I will continue to do, is advocate for a pipeline so that we can impact the number of kids who can get jobs, who can be healthy, who can enjoy our pool by becoming lifeguards. And to that end, you've heard Mr. Cross say that our administrator and Ms. Obert on our Parks and Rec staff and I met with Dr. Faust in either late November or early December to impress upon him and staff our need for lifeguards and training to make that a part of the regular school curriculum. And he was receptive to that. So we will continue down that path to try to open up opportunities for kids who want to become lifeguards. The second thing, though, we couldn't overcome was just the presence of COVID and what that means to a pool environment. We are going to err on the side of safety. I can't tell you what the 6 numbers for Powerball are going to be, but I can tell you with this approach, not one person is going to become ill from this dreadful virus because we elected to open the pool. I know this is a hardship for a lot of people, but we're going to come through this safely, using safety and the science that our medical professionals have already shared with us. You may have heard that this virus is impacting minority populations across the country very heavily. There are a lot of kids of all persuasions, but mainly African American and Hispanic, who use the pool at Parkwood. I don't want it said that because we made a bad decision that we didn't have to make, that we endanger the lives of any of our populace. So I'd like to take this opportunity again to thank the wonderful staff who's there. Parkwood Pool has been open almost 50 years. And for about half that time, Mr. Earl Watson has been the pool manager, and he just does a fantastic job, well known in the neighborhood. I can't imagine that pool without Mr. Watson. I want to thank Ms. Doris Jones, who checks the kids in and keeps track of who comes and goes there. Our top flight security personnel, Officer E. Diane Simmons and Officer Mike Simmons, those people who are at the pool but work behind the scenes quite often, Ms. Shelley Boyd Burnett, Mr. Jack Webb with Public Works, and Ms. Angel Obert. Just can't thank them enough, and the support of our administrator, who was able to come up with some money to increase the pay for kids. So we're looking to be a viable option in terms of an employer in the future for kids in the community. So I just want to thank everybody and know that we are looking at this positively going forward to increase the number of lifeguards and to outlast this dreadful virus with no loss of life or infection with Parkwood Pool. So thank you very much.
Mayor, that concludes the presentation we have. If there are any questions for any of our staff members, we'd be happy to answer them. I see.
Yeah, I don't.
Ramirez.
Yes, go right ahead.
Thank you, Mr. Administrator, Mr. Mayor. I want to thank Mr. Cross, Commissioner Townsend, Parks and Rec, and Commissioner Bynum for the work that they're doing. It's being felt, like Commissioner Townsend said, everywhere, especially, in Johnson County. I work in a summer program. We've canceled all field trips, all pool days, just because of this. And so I just reiterating to the community that this is something that we had to do. It's something that we didn't want to do, but we have to make sure that our children are safe, because they could very well help spread this, and we don't want that to happen. So I just want to thank all the staff for their hard work on this, especially the Parks and Rec staff. You guys are amazing, and thank you very much.
Commissioner McKiernan.
Thank you, Mr. Mayor. Just a couple of questions for the folks in the health department. So far, we have been posting numbers of cases and numbers of deaths on our hub. And by the way, I do want to say that the information, both the data and the general information presented on that hub, are absolutely phenomenal. And so thanks to everyone who works on that and puts those data and that information out for us to look at. I was wondering when we might have number of hospitalizations available to keep a tally of on the hub.
Gosh darn it, you had to ask that question, didn't you? I appreciate that. We are working very hard to figure this situation out. It's a little tricky, and it involves Topeka, and it involves the State Hospital Association and the lack of a central location where hospitals are sending data on a day-to-day basis. So I certainly don't want to imply that our hospitals aren't being participatory and trying to work with us on this, but there's not an infrastructure built for this, unfortunately, in Kansas or on the Kansas side of the metro. And so we continue to kind of get some daily numbers occasionally from folks at our 11 a.m. call, which is helpful. And we are in conversations with what's called LACI, the Lewis and Clark Information Exchange, to try to figure out how to get better access to that and get both of our hospitals participating in that more robustly. So the short answer is that we're working on it, and we don't have a great system yet, but we are hoping to in upcoming weeks.
Would it be accurate to say that we have more direct influence or control over number of new cases and number of deaths, but we are a step removed in the process of number of hospitalizations?
Sure. Yes, that's absolutely true. Yes.
Okay.
And I would also say that, hospitals, they're paying so close attention to this, and they are quick to flag and to kind of put out the SOS call when they're kind of in a time of trouble. So as Dr. Greiner mentioned, we're fairly stable, and we're not super concerned about that right now. Obviously, we're keeping our eye on it, but it's not a major concern.
One of the other things that we said we would make decisions on in terms of moving zones is to look at the percent positive. And I think I know the answer to this, but I just want to confirm, will we look for some sort of absolute number below which we're good, or are we going to look at trend in percent positive just like we do our other indicators?
Good question, Commissioner. I think it's going to be trend because we've been so high on that positivity rate. I think as we get further along down the line and are into the summer or maybe even next fall, I think, our goal is to have ongoing testing happening and have those numbers way down below 5% positive coming back. But we're so far from that now, I don't think we can expect to get there necessarily anytime soon. So we'll be following that trend and working with that for our decision making, and then long term, really try to have a lot more robust activity around testing so that we can figure out if we're going to get another spike in the fall or next winter.
Thank you. And then just one more question. I know that we have said that our goal is to test ideally 10% of our population. And I heard yesterday that we're roughly a third of the way there in terms of number of tests completed. And I was just curious if we have any idea as to how long it might take us to get to our goal in terms of number of tests performed. And then a second question would be, are there factors out of our control, like the availability of either testing materials or test analysis capacity? Is there something out of our control that might delay us getting to our goal?
I think we feel pretty comfortable that supplies and as well as test capacity have risen to the point we can get where we need to be. We'll have a new question coming online though in terms of doing what we call cyclical testing in some populations. We're hoping that by mid-July, so about 2 months from now, we'll have reached that 10% goal, especially with the help we're getting in the collaboration with KU Health System, with Vibrant Health. The Swope Wyandotte is also conducting some pop-up testing events in our county. And then the heart-to-heart testing I mentioned, as well as many of you may have heard that Walmart out at the Legends and in Bonner Springs is starting up as of tomorrow, and we'll be doing three days a week testing. But we are also now beginning to realize that there will probably be need for cycles of testing in some of the negative populations. So if we are able, for example, to start doing more testing in long-term care facilities, or more testing of the asymptomatic contacts of positive cases, we may have to keep going back and on, say, a 7-day or 14-day cycle, retesting those groups of people. And so then we'll have to create a sort of new calculus for what we see as the goal around that. And it may be that by next fall we want to have tested 10% of our population twice over. That's very possible. So we look forward to finding the right science to guide us in that regard, because it's all evolving. But I think we've been very pleased both with the support of the UG in allowing us to get the testing off the ground with that initial $50,000, as well as the collaborative efforts across multiple institutions to keep it cranking.
Thank you. Last question, I promise. So far, in terms of people who are asymptomatic, if I understand correctly, we're only testing people who are asymptomatic who may have been part of an exposure group. Do we ever anticipate testing broadly those people who are both asymptomatic and not necessarily associated with a hotspot or an exposure group?
Yes, we do. In fact, Heart to Heart, their initiative, which they've kind of initially designed themselves, although we've been in some communication with them, is to do that. And in fact, they would like to do that across the whole Kansas City Metro for first responders in the next couple of weeks. But then we're working with them to figure out a sampling strategy that we can deploy that would allow us to at least use some good demographic science to decide who and where we find somewhat of a representative sample. It may be impossible to do this as well as we do other representative sampling when we're doing things like surveys, but to do something that gets us good data on those just normal asymptomatic citizens. So we hope that within a few weeks, we'll have a plan and possibly even rolling that forward with the partnership with Heart to Heart.
Thank you so much. And thanks to you and everybody who's been working on this. I think we're really beginning to wrap our brains around the complexity of this. So thanks again for your work.
Thank you. And I just want to, again, highlight Dr. Greiner's original comments that in terms of the capacity of the testing, that's really good. We also have to ramp up the capacity for the contact tracing. We have to be able to identify those individuals who may have come into contact so we can continue to isolate the spread. So we have to keep obviously both of those in mind. All right, thank you for that presentation. Now we move to our Economic Development Incentives Report and Catherine Carter.
I believe Catherine is getting us a report up. Catherine is our Director of Economic Development, and this is a report that we originally worked on or had ready to go about 30 days ago. It was held back because we were getting things ready. So, Catherine, are you all set?
Yes, thank you. So good evening, everyone. As Doug mentioned, this is a report that we finished right at the very beginning of March. So excellent time to get that out to the public, but we're excited to now be able to share this with you. This is a report that we hope to be the first of an annual.
Catherine, you have some audio problems.
Ooh.
You're clear there.
Okay, perfect. That's my speaker.
You're muted now. Can we take Catherine off mute?
Okay. Yes? No?
Yes. Yes.
Okay. Let me know if something happens again. This fortunate situation, but my part's not that long, so hopefully it'll be fast. So as I was saying, this is planned to be the first annual report. We really want to be able to be very clear with the commission as well as the general public about what the new projects are, how the old projects are doing, really be incredibly transparent with what we're using as economic incentives and why we are doing that. So this will just be a presentation that's a brief overview of the report, and also should be used kind of as a companion to get the most out of the report. For the most part, we are not going to be doing project by project in this presentation, but all of that is in the full report, which will be it's part of this agenda and will be posted on our website as well. So just okay. So just some quick kind of high level kind of what's the point of economic development and incentives, and it really is to drive development and meet community goals while also being fiscally responsible. So really the long-term goals that we place and we think about with every single project is how is this going to grow our economic base? How is it going to raise household income, add quality jobs, and bring desired amenities to our community? So has the unified government been successful? I think certainly overall, that's a resounding yes. We really have tried to tie or to use incentives in a way that will bring, projects that will really move forward with a lot of those goals that we want. Some of the things, it's kind of sure it's not 100% where everything is successful, but I think certainly overall there's been a very positive return on our investment. And then a couple of the kind of secondary, not direct returns, but kind of other things that we use to look and see if kind of overall what we've been doing is successful is the amount of investment, and then looking also at median household income. Both are quite significant. There's we're about, in the last just over 10 years, had almost $5 billion of investment in the county, and our median household income has risen more than $7,500, which in about 15 years, which is pretty significant. Now, specific to kind of what we're talking about in this report, so how are we doing in 2019? I will say that our goal is always for development to really benefit as many residents as possible. So one of the things that we really try to do is not have development focused in any one area of the county or city. And I think, as you can see, these are just a few of the projects that we've been working on this past year, and you can see kind of how they are spread out over the entire city. I'd also like to point out that not all of the projects have needed incentives, and that is certainly the goal of many incentives, is to kind of give that assistance when it's needed, hope to get that market moving, and then kind of let the market do its thing and be able to kind of decrease the amount of assistance we provide, or in some cases provide none at all. Also, the state has provided different tax credits and things on some of these in addition. So what we're going to be talking about today, we'll have a number of different speakers, but really kind of focus on property and sales tax based assistance tools. I want to mention, I think a lot of people aren't always quite sure how these type of incentives work, but I wouldn't say 100%, but the vast majority are really based on new incremental taxes. So whatever the tax base is in these instances, that always remains. And this is really looking at kind of what we do with the remainder of those taxes when they're building something new and the property tax increases. How can we use that as a way to get more out of that project, whether it's a rebate or redirecting the money back into the project so they can build more. There's a number of different ways to do that. Also, these tools can be layered. So I want to mention that, and you'll see that as we go through. So as we go through the Neighborhood Revitalization Act, the NRA, Stephanie Moore is going to be presenting on that. Jim Erickson will present our industrial revenue bonds. Elise Villarreal and Debbie Johnshire will talk about tax increment financing, community improvement districts, and transportation development districts. And then Kathleen Von Atchen will provide our conclusion. So I will just encourage anyone who is interested and sees this and wants to learn more. We've got about 100-page long report, which goes through every single project we have out there, as well as a star bond report as an appendix. So if you're interested in that too. So with that, I will turn it over to Stephanie to discuss Neighborhood Revitalization Act.
Thank you, Catherine. Good evening, everyone. Stephanie Moore, Management Analyst for Economic Development. And this report comes at a very good time, as this year we're going to be renewing the NRA program. It's due for renewal. So stay tuned for future updates on those meetings. And as some of you may know, we've had NRA for over 20 years in our community. It's a rebate on property taxes on that incremental increase after the construction and that increase in improvement. And it's eligible for new construction, rehab, and residential and commercial developments. Next slide. All right, so this map has a lot going on, so take a moment and look at this. NRA is doing what it's intended to do. It is working. As you see in Area 1 to the right in the pink area east of 635, these are the active NRAs from 2010 to 2019. And Area 1 has the most with 216, and followed by Area 2 East with 67. All those dots should represent one active project. And areas 3 and 4 to the west have low or no participation. So, are there any questions on the map? And I'd slow me down if I'm going too fast. Okay, and then this is more of just a breakdown of what you just saw, the 53 and the 260, but that larger amount at the bottom is over the 10-year term, the rebated taxes. They're still paying 100% of their full tax and getting 95% back on that incremental increase again. So it's only on the increase. And then this is a very interesting slide. I was personally like, wow, 5% in the increase in the appraised value on those active NRA. So the pre-construction was at 27 and then posts 125. So that's a five-fold in the increase. So that's a big jump. And then next are some examples of active NRAs. This is a rehab, and that's near 25th and Washington. Looks amazing. And these are infill, new construction. That top one's near 46th and Rainbow. And then we'll give you some commercial. This is near 7th and Clindenberg. I can never pronounce that, over in Fairfax. And the last one is over at Caw Drive, 70th and Kansas Avenue. So we have a wide variety of examples and eligible activities, and it's a great program. I think that's my last slide, Catherine. Yep, I'm moving it on to Jim if there's no questions.
Yep. This is Jim Erickson, Economic Development Manager. Good evening. We're going to go through industrial revenue bonds next. Industrial revenue bonds, just as a name, is a little bit misleading. They can be used for more purposes than just industrial projects. And just for a little bit of context, some of you are more familiar than others on how an IRB works. The short version is it functions similar as a tax abatement. The longer version is that an investment is made basically in the UG's name as a tax exempt entity. The UG pays no taxes, and so there's a lot of tax savings to pass on. Again, this is new increment we're talking about. And on the other side of the deal, we work with the developer to negotiate what we call a pilot, a payment in lieu of taxes, which essentially functions as a tax. And so we have had 33 such projects since 2006, 28 remain active, 5 have graduated. The total amount of industrial revenue bonds we've issued are $858 million. And again, I want to emphasize that this is not debt that the UG is liable for. This is not money that ever touched the general fund. That's just a figure that reflects investment. So really the bigger that number is, the better. And another thing we should always mention with an IRB, when you say it's made in the UG's name, the UG has deed to the investment. It's important to note that the UG has no debt liability. This is conduit debt. It has no ability to touch the UG. And also, if there were to be an injury on a project site, for example, and that person were to sue the developer, even though it's in the UG's name, the UG is not liable for that. So really, it's just something that is a mechanical thing that the investment passes through the UG for the tax savings. Our policy has us maxing out that exemption on savings at 75% of the new incremental taxes. So that's typically a maximum. Our abatements generally start at about 45%. I'll move to the next slide. Here's a map of active IRBs. A lot of them are either at the same site or across the street, so it will look like there's not 33 dots here, and that's kind of correct. So some of these are lapped on top of each other. Next slide. And again, to use an apples to apples comparison, we're using appraised value. And so when we looked at these sites, we saw the year before the IRB was issued on each site, no matter what the year the project was issued, we always looked at the year before. There was $177 million of appraised value on those sites. Those same sites after the IRB was issued, as of 2020, was $444 million. And so that was an increase of 151% of just the appraised value on our IRB sites. We put some numbers together. I worked with finance just to get an estimate, and to be clear, these are estimates of what would these projects be paying once they're all retired. What is this 151% increase, new appraised value? What does it actually mean to them? Tax dollars. And if we were to use average mill rates across the county, essentially what that figure is $11.4 million to all taxing jurisdictions and $5.2 million just to the unified government. Again, not all of these taxes are getting paid. There's portions of them that are exempt for the life of the IRB, but that once these IRBs that are currently there are all retired, that's an estimate of what type of new tax revenue is being brought in due to these projects. Next slide.
All right. Hello, everyone. Good evening. Thank you, Jim. My name is Elise Villarreal. I'm the debt coordinator of the finance department. And I'm going to be covering the next few slides, which are meant to give you just a quick look at the types of information that's contained in the individual project pages. We really encourage everybody to go take a look at that very long, very in-depth report. And these next few slides will help familiarize you with what's contained in that so that you can go exactly where you want to go. But
Elise,
and then
Elise,
after that, yes.
Elise, this is Mayor Alvey. We have Commissioner McKiernan, I think, has a question. Let's go ahead.
Oh, okay.
Before we move on to the next section.
Sure.
Actually, it's not really a question. I just want to make sure that we explain, and this goes all the way back to NRA, and it still applies to IRBs, but it goes all the way back to NRA. And I just want to make sure that we explain kind of the premise of this in a way that people get what we mean when we say the base and the increment and a percent of the increment. And so just really to be very simple about this, and you check me if I'm wrong on this, but let's say that we have a property that is today paying $1,000 a year in taxes. Mm-hmm. That is the amount that we would call the base. It's the amount that that property is valued at and is paying today. And let's say that the person or the company that owns that property says, hey, we want to invest in our property and we're going to make a physical investment in it, and that will raise the value of our property. But we can't fund all of that investment right now. So the value proposition we make is, let's say for the sake of argument, that they're going to make an improvement that would add $200 a year to their tax bill. That 200 now is the increment. Mm-hmm. And we make a deal that says, I tell you what, to give you the capability of funding the improvement in your property, we will rebate a certain percentage of that added value, the value you're going to add. So after the NRA, this company would still pay the $1,000 a year that they've been paying all along. Mm-hmm. They'd pay their $200 extra, and then we would rebate back to them, let's say $180 that they could use to fund the improvements. And we do that for 10 years.
It depends which area you are. So it's either 5 or 10 years, but yeah.
So let's just, for the sake of argument, say that we do that for 10 years. And at the end of that 10 years, then that company or that individual pays the total amount of their base and the total amount of their increment. They pay the total tax bill.
Right.
We have just given them back a portion of it for 10 years to seed or enable them to make the improvements. And at the end of 10 years, then we get all the taxes. So I want to make sure that we help people understand when we talk about base and increment, that when we do this tax rebate, we're not rebating any of the taxes that they were already paying. They're going to continue to pay that. We are just rebating based on the value that they add.
Correct. Yeah. So for example, just looking at this slide, I mean, this is taking all of them together, but, you know, so all of the NRAs, you know, have the, before they applied, had a pre-construction appraised value of $27 million. But then as Commissioner McKiernan explained, so that's, they're paying taxes on that. They will always pay taxes on that. Then they are putting in, you know, whether they're building new or rehabbing a structure, that has increased that 27 to $125 million. And so we are rebating a portion of that additional taxes, but then at the end of the 5 or 10 years, whatever the term may be, then we are getting taxes on that entire $125 million.
And a lot of people who have concerns, they talk about the fact that we're giving away tax money. And I want to make sure that we're clear on the fact that we are not giving away or rebating anything that we are currently collecting.
Correct.
We are only using the rebate as a mechanism to encourage additional investment. And so I hate to use the words but I'm going to. I mean, in many cases, if it weren't for the fact that we are willing to give this rebate, a company or an individual might choose not to make that investment in their property. So we're making a long-term investment in our community when we give these rebates on the increment or the additional value.
Yeah, exactly. And as we look at also the industrial revenue bonds, it's a similar, it's a kind of a different mechanism, but similar idea, where there's amount of money that's being invested, and we are trying to encourage people to build and invest in their properties, and for that, giving them a bit of a break on
Catherine,
the additional.
Your voice is being garbled again.
All right, I'll let Elise go.
I think if you stay closer to the screen, it's working better. It's when you sit back, I think.
Thanks. All right, Elise, back to you.
Okay, thank you. No, that was very well stated. And let me try and do something similar for this next slide, because the next, the project pages are development projects that have received sometimes one public incentive and sometimes multiple public incentives in varying degrees. They may have caps and limitations on some of them, but similar to, I'm going to start at the bottom with TIF, Tax Increment Financing. This is a very similar concept with a base and an increment. And so the project, the base continues to flow through to the taxing jurisdictions like normal. And the increment is what helps fund the project. And it may be 100% of the increment or maybe some other percentage. And the good thing about TIFs is that not all, the full amount of their mills aren't pledged. So they see some of that right away, rather than the life of a TIF district is 20 years. And so rather than waiting 20 years to receive the value of the increment, they get to see it right away. Whereas some of the other taxing jurisdictions, the life of the project, if it's pledged the full 20 years, that's when the other taxing jurisdictions begin to see the value of that increment flow through to them. Now, in the case of CIDs and TDDs. These are community improvement districts and transportation development districts. And what these are additional sales taxes that, and they have to go through a process where they're approved by the businesses in the taxing jurisdiction, but they're an additional sales tax or assessment that's imposed in a particular boundary. And so all the taxes that the jurisdictions were receiving are continued to be received, and this extra sales tax that's agreed upon is used to fund the project. And they both last for 22 years, up to 22 years. And then sales tax rebates are similar. It's project generated, but it's not the same statutes as the CIDs or the TDs. And so continuing with the presentation, we've got a map of all the different projects that we looked at and where they're located. So it's spread throughout the county. Yeah, let's go ahead and go to the next slide, please. Thank you. So the project case studies, they're the development projects that we've undertaken, which are considered active because they have an active sales tax district, or they have an incentive which is being imposed, which we're tracking. And these projects, like I said before, often have a varying composition of incentives. They might receive TIF and CID, for example, but they could have caps and limitations on each. So in the report, we've provided information even on some of the TIF districts that were created but are considered inactive, because we want to keep those in front of you all. And they might be inactive because there's not a project plan, or in some cases the project plan was approved, but the development hasn't progressed. So they're still outstanding. There's still potential for a development to occur in that area and receive TIF incentives. Next slide, please. So each project is at least a couple pages long, sometimes more if it's more complex. And although the projects differ in scale and complexity, we've tried our best to collect the information and present it in a fairly consistent manner to better easily digest all of the information. So on the first page, in the upper right-hand corner, we've got the name of the project, and below it is a very brief summary of what the project description is. Next, please. These are going to go by quick. We've located, or we've shown you where in the county the project generally is, in the upper left-hand corner. Next. And then this box right here contains the project terms and conditions. It contains the approval date, the commission district. We've summarized what those pledged revenues are. And here we'll discuss the main project caps and limitations, although sometimes there's a lot of different in the development agreement. So we've discussed the major ones in here, as well as the public versus private incentives and total investment. Next, please. In the lower right-hand corner, we've provided a quick status, whether the project's completed, if it's in progress, and what kind of progress that is, if it's not yet started. And we've also provided a list of the top vendors or taxpayers. For the districts that contain a handful of vendors, we were able to list all of them. However, some districts contain more than we had room for, so we just listed some of the main ones. And it's really just to provide reference for how many vendors are located in the district. They're not listed in any particular order, and the reference to top can change from one period to the next. So this isn't really meant to be a ranking, rather than just to give context to the type of businesses located and are supporting the project. Next, please. Okay, on the following pages is where we dive deeper into each of the districts that have been created. So we've provided a map of the district, or the boundary where the pledged revenues are, and we've noted the major streets for context. Next. And then for each type of pledged incentive, we have a quick summary box containing some of, excuse me, containing the term of the revenue pledged. Like I said, PDDs and CIDs are 22 years. TIFs are generally 20 years. And if it's less, we've noted that. And then we also have what's being pledged and the type of financing that this incentive is being included in. So let's go to the next slide so I can talk a little bit more about the types of financing, because this is really important. The types of financing vary from least risky to the unified government and the taxpayers, and then to most risky. So for pay-as-you-go, this method of financing is the least risky to DOG. As revenues are received, they're distributed, and so there's no sort of liability to pay more than what we've received. Then when we go to special obligation bonds, this is where we've issued bonds ahead of time, and so the developer submits cost certification certifying that, hey, this project has these costs, and they're reviewed, and then they're able to be paid from the bond proceeds. And so what happens with the project revenues is they are received and they are remitted to the bond for payment of debt service on the project. But for these types of bonds, it's the project revenues that back these bonds. To add another backing, an annual appropriation backing to special obligation bonds, makes them less risky to the investor, but more risky to the unified government. Sometimes this has to happen for a deal to even be possible, for a bond to be marketable. And this often occurs when revenues from the district, they're not proven, there's no history, and maybe the projected coverage isn't 1.5% or whatever that desired level is for the deal to be marketable. And so with these projects, not yet, would you mind going back? Thank you. For these projects, we scrutinize them quite a bit more because we're adding our backing to it. This is when we start getting more involved in it. It's from a government and a taxpayer standpoint. And then the highest level of risk are the general obligation bonds, and they're the riskiest to the unified government. So should the revenues prove insufficient for the repayment of debt service, this is when our full faith and credit backing kicks into effect, and we have to do everything in our powers to repay the debt service on this, including levying for that amount. Okay, next slide. So if the incentives are pay-go, then we've provided this project performance box, and this is the box you're going to want to go to review our evaluation and our analysis of how the project's doing. We look back at the projections that were put in place when the plan was approved and submitted, and we compare the revenue collections with those projections. Next, please. For bond performance, it's the same box, it's just got some more information to it. We've included the total liability, which are the principal and interest payments because the revenues support both, and how much that's outstanding, as well as when the bonds mature. And here, often we get an even more in-depth projections that have to support the bond issuance. So we've compared those, maybe not to the project plan projections, but rather to the feasibility study and the bond projection. And then we assess whether the revenues have been sufficient to meet debt service, and we forecast whether or not we think that they're going to pay off by maturity. Next, please. Thank you. And this information is actually on the first page of each project, and it's just 5 key categories for evaluation. Are the revenues sufficient to cover the expense of each project? Based off historical revenues, are the bonds or project costs expected to pay off by the time the revenue collection ends? Has the project improved the amenities and the resources in our community and contributed to our effort to make Wyandotte County and Kansas City, Kansas a better, more enjoyable and desirable place to live? Did the project spur private investment into our community, and has the project diversified and strengthened our tax base? At this point, I'm going to turn it over to Debbie Johnsher, our Deputy CFO, to further discuss the projects and incentives provided. Thank you.
Good evening, Debbie Johnsher, Deputy CFO. My next slides are going to talk about, just go into a little bit more detail on what incentives are on the projects, and then maybe talk a little bit about how the projects are performing. So this first slide here just shows the incentives by type. I believe we've talked about most of them, the largest being the tax increment financing. We have 22 projects that are TIF projects. The next largest was the CID, which is the Community Improvement District sales tax. We have 11 projects there. And then the TDD projects, we have 8 of those. The TDD and the CID are the additional sales tax that Elise referred to. We also have a couple of projects that have transient guest tax pledged with them if there is a hotel in the project. We talked about the NRA. Property rebate is similar to the sales tax rebate or the TIF. You get a rebate on the property taxes paid. I think there is a little bit of difference between this and the TIF. I think it also looks at the property tax rebate looks at different statutes. And then we have an economic development. We have 2 projects that have economic development grant, and those are bonds that the UG would issue under its home rule economic development grant. So going on to the next slide, just talks about the financing of each of the projects, and Elise kind of went into this as for how we fund the projects. So we have 27 projects that are pay as you go, and as she said, these are the least risky because we don't pay the money up front in a bond. As we collect the revenues on the project, then we do the reimbursement back to the developer. So we have 27 projects there. We also have 11 projects where we have issued revenue bonds, and those projects, so the developer or gets the money goes back to the project at the beginning of the financing, and then the revenues collected go to pay off the debt service. We also have 13 projects that are backed with general obligation bonds, and 4 projects that have annual appropriation. And as Elise talked, that these are the most risky because if the revenues generated on the project don't meet the projections, having the GO backing, we are at risk of having to pay that debt service. Next slide has a listing of all of the projects. There's 30 projects on this list, and we have shown what incentive is on what type of incentive each project has. And you will see that some projects may only be a TIF project, but we may also have projects that have several of the incentives. For instance, the second project listed there, 39th and Rainbow, is not only in a TIF district, but it also has a CID sales tax, and we have pledged transient guest tax. So each one of these projects lists what the different types of incentives they have. Now, I'm just going to show you that we have a couple of new projects that are included. However, I did want to note that these projects are either in the construction phase or the project has just begun. So there's not really enough information to report any kind of performance on these projects yet because they're still in the beginning stages. And that's the 3 projects are the Downtown Grocery Store, the Scavuzzo's Foodie Park, and the Turner Logistics, which is the Turner Diagonal and I-70 project. We also have 6 projects that are inactive. Elise referred to this, I think, in her presentation. All of these projects had TIF districts created. However, no project plan has ever developed. So these are listed as inactive projects, and therefore we have no information really to report on those. Now we'll go into the projects that, we're not going to go into a lot of detail on the individual projects. That's all in the reports. But if you have any questions on an individual project, just let us know. But I'm just going to cover all of these projects listed here. The revenues are covering the expenses, and these projects are expected to either pay off on schedule or potentially early. We do have two projects, Happy Foods and Prescott Plaza, that I'm going to talk about at the end of my presentation, that the TDD bonds are paying off early. And so I'll give an update on those. The next slide, we want to just talk about projects that are where the revenues are not covering the expense. So we'll start with on the top there, we have two projects that are pay-as-you-go, Northwood and Shawnee Plaza. Northwood has a sales tax rebate, a CID, and an NRA, and Shawnee Plaza has a CID and a sales tax rebate. Neither of these are have bonds issued and are not a UG unified government obligation, but they they're not the revenues that were projected when the project was started. The revenues that we're actually receiving are not meeting those projections. The next one,
Debbie,
oh,
Debbie,
yes, go ahead.
if you would, so in that circumstance, then what happens, or what's the long-term, repercussions of that? They're not, revenue's not covering expense. It's no risk to us, but what is the risk there, and what effects did that have?
The implication would be on, I would assume, on the developer who did the improvements. They put up the money to do the improvements. They took the risk that issuing the CID and that the sales tax revenues that came in would cover that project, but they assumed the risk on these two projects. So the shortfall would come to the developer of the project.
Thank you. I just wanted to be clear about that.
Mm-hmm. Now, the next one is a special obligation bond, Wyandotte Plaza. And we had this listed under revenues not covering expenses because when this project was bonded, the projections that came out, the revenue sources are underperforming compared with those projections. However, as we looked at this closer, the projections still anticipate that these bonds could potentially pay off early, possibly in 2027, and the bond maturity is in 2034. So even though they're not meeting the projections, we are currently expecting that this project could pay off early. It is also not a UG. There are special obligation bonds. When the bonds were first issued, there was an annual appropriation attached to the bonds, but they were refinanced in 2016, and the annual appropriation was removed at that time. So there is no obligation of the unified government for these bonds if they were not to perform. But currently, it looks like even though they're not meeting the original projections, that it does look like these bonds could potentially pay off early. And then the last one is the special obligation bonds for Sporting Kansas City for the Sporting parking lot. These bonds do have an annual appropriation. There's currently, the bonds were issued for the parking lots that are on land owned by the Kansas Speedway. There's a CID, a TDD, and a ticket tax that are to cover the ground lease. And the ground lease is a lease between the unified government and Kansas Speedway to pay for the use of the land. And then the debt service covers the improvements that were made to the parking lot. Currently, the revenues are not sufficient to cover both the ground lease and the debt service. And we're projecting that at the current rate, the unified government would have to pay the revenues would not cover the existing debt service. So we have had conversations with Sporting Kansas City regarding possibly increasing the ticket tax for 2021. And we're also looking at a potential refinancing on the 2010 H series, which funded the improvements for the parking lot, to see if we can possibly lower the interest rate and lower the debt service payments on that bond issue. The next slide shows these are 3 residential projects that all have general obligation bonds issued for these projects, and they are not meeting their projections. The total, they are Mission Cliffs, Peregrine Falcon, and St. Peter's Waterway. The total debt issued was $10.5 million for the 3 projects, and we're expecting that the anticipated TIF revenue shortfall is about $6.2 million. The revenue collection period ends in 2025. So currently we're projecting that we're only going to collect about 40% of what we needed to for these residential projects. As I said, we have 2 projects where the TDD bonds are paying off early, so I wanted to talk about those. Happy Foods is a grocery store that's located at 55th and Leavenworth Road. The TDD district was created in 2008 with a 1% sales tax. Bonds were issued in the amount of $400,000 in 2009, which went to cover parking lot repair and overlay, exterior storefront, lighting, and also building signage. This grocery store had been closed due to a fire. And this is one of the projects where we do have the economic development grant, which funded improvements for roof replacement, fire and water damage for repair, and some HVAC repairs. So the TDD is just a portion of the amount financed for this on this project. The bonds were scheduled to mature in 2024, in June of 2024, but we're expecting that they are going to pay off in June of 2020, which would be 4 years early. The next project is Prescott Plaza Tdd. This TDD district was created in 2007, also with a 1% sales tax. In 2008, we issued bonds, tax revenue bonds, in the amount of $2 million. They were also scheduled to mature in June of 2024 and are expected to pay off in June of 2020, 4 years early. This is the grocery store and retail area that's located at 18th and I-70. And let's see, it included I think demolition of the buildings that were on the site, environmental remediation of the truck stop that was there, as well as construction of the grocery store. There's also other retail. There's a convenience store that are also located within this district. So once the TDD bonds pay off, what we will do is terminate the district and sales tax in 2020. And so that concludes my part. Now I'm going to turn it over to Kathleen Von Atchen, our CFO, for the conclusion.
Kathleen, I believe you're muted.
Thank you so much. Sorry about that. I did want to talk just briefly about a few key takeaways about measuring our success with economic development. And we're so pleased that we've put together this report. It's something that I envisioned when I first started 4 years ago, and I thought the report was very comprehensive. In the future, we hope to also include the star bonds, so look for that. Generally, economic development programs are difficult to evaluate due to the distance between the program activities that are occurring and then the desired long-term performance or outcome that we're looking for. And so economic development, it yields improved capacities for participants, like entrepreneurs and small businesses and regional organizations. And it also broadens our economic benefits to our residents through potentially the opportunity to earn more income or to expand the jobs that we're creating in our community. But these benefits are sometimes difficult to capture in the short term, and or just by looking at one single project. So the challenge is to find valid indicators for these complex programs. And I hope that our program evaluation, our metrics, assists in assessing the impact of the economic development and how it builds capacity in our community and our community's economic performance. So on the next slide. So the next set, this new set of performance measures basically is aimed at how are we enhancing our local and regional competitiveness, and how are we boosting local capacity to support private investment and to support economic growth. And we hope that the new approach is measuring our success. It assumes that economic growth is measured by jobs or capital investment or an increase in our tax base, for example, and that should eventually lead to qualitative improvements to our local and regional economy over the long term. So yet it is difficult and difficult economic times, and in an environment where we're always wanting to support our decisions with good evidence, that it's important to develop good tools to allow policymakers to focus on the future economic benefits of programs and policies. So we hope that this report achieves that. And of course, we're always open to any feedback from yourselves or the community about what other metrics should we include in assessing the success of our economic development programs. So we're happy to incorporate that into future reports.
So, Catherine and Kathleen, I think one of the things when we look at the performance, the checklist there, you know, revenue covers expense, pay off on schedule, improve community resources, you know, that important measure of increasing the median household income, you know, providing jobs that are, you know, based within our city, available to our residents. How is that considered? I know sometimes there is a point system on some of these, that we assign points to certain development projects or RFPs, and if they meet those criteria, they get extra points for that. Just tell me, how do we measure that? Because as we know, you know, increasing the median household income, as we highlighted, is so important for us, and that's been one of the primary goals of Wyandotte Economic Development Council for really the past 8 or 9 years. So if you could speak to that.
Yeah, so hopefully you can hear me. Well, fingers crossed. So as we move forward, some of the things like median household income, that's a very difficult one to look at on a project by project basis. I mean, some projects are large enough that we can actually tell. For example, Amazon, we have been able to see a direct correlation with some of the zip codes and increased household income. That, again, it's a correlation, not causation. So we're assuming make some assumptions there. But we do, especially IRBs is a great example, where we have a base amount of abatement that we'd offer. And then if they do different things, we would provide additional abatement on top of that. So for example, you know, if it's, you know, hits a certain amount of, I think it's $50 million in investment, they get another 10%. If they are hiring Wyandotte County residents, they get another few percent. If they are using a certain amount of MBE, WB, LBE contractors for the work, they get additional. So there are things like that where we can really put it into the kind of calculus. That being said, our goal is always to fill the gap and not additional. So we don't want anyone kind of making money off of this. I mean, the point is to do, you know, only as much as is necessary to get the project done. And so if there are ways that we can help fill some gap and they're able to do some things that are meeting community goals, then it's a real win-win.
And would you also speak to, this is more, I think, for the public, the necessity of doing these, the but for, if we don't do this, it won't happen, that we are really in a competitive environment, and economic development incentives really should be directed really to those areas of the economy that need redevelopment, and they have been generalized so that even affluent areas now can use them, and they do very successfully. In fact, have an advantage because they are able to maintain a low tax rate and then even offer a greater incentive. So if you just speak to that a little bit.
Sure. So one of the reasons it is that Kathleen was talking about, it is kind of difficult to really evaluate is because it's, you know, we can do kind of a but for test. So but for these incentives, would this project build here? But at the end of the day, we don't actually, you know, there's no, you know, kind of what would happen if we didn't do this, because that we did. So, but we really try to look at especially projects that are attraction projects. So this is a project a lot of times, you know, a regional headquarters or something like that, that's maybe looking at, you know, Cleveland, Dallas, and Kansas City. And in those situations, it's kind of a tricky calculus because we want to make sure that we are providing enough incentive to win the project, but also not, you know, still not an excessive amount, so that we are getting benefit from that. And in those cases, it really is all about selling our community, selling our workforce, really talking up of all the great things that if you brought your business here, you know, kind of all those intangibles in addition to the incentives that we, you know, that package that we put together. Then there are a number of projects, you know, apartment projects, stuff like that, where we're not in competition, but because the market, for example, downtown, the market isn't quite to a point where market rate is something that is easy to build, because our rents are much lower. So then, because of different policy decisions by you all, you know, we are trying to encourage that. And so hopefully the goal is that, you know, for these kind of first in projects, we're giving kind of additional incentives and assistance, but those will help raise the rents. For market rate, we'll still have a nice mix of different rents downtown and across the county, but that will help so that with future projects, we'll have to provide, you know, less and less assistance.
Thank you. I go in order here, Commissioner Bynum.
Hi, thank you, Mayor. A question on the CIDs that are getting ready to pay off. I think there were several, one of which is Happy Foods and one at Prescott. Can you clarify that, for example, with Happy Foods, it's a 1% CID, it's going to pay off in June. So once that is canceled,
it will decrease the sales tax by 1%.
Perfect. That's exactly what I wanted to hear you say. Thank you so much. And
and same with Prescott.
And it also pays off in June. Okay, excellent. Thank you.
Commissioner Walters.
Yes, thank you. I appreciate the report. I have a couple comments, things that weren't exactly clear to me, and maybe you don't need to clarify them now, but keep them in mind maybe for future reports. Some of your examples identified taxes created or taxes generated, and it's always confusing to me what you're talking about. Is that for a specific taxing year? For example, $5 million in new taxes for calendar year 2019, or is it a 5-year period or a 10-year period, or just what? So I think specific information or clarification of exactly what you're talking about when you talk about new taxes created would help me. On the NRAs, I believe you are referring to a 10-year time period from 2010 to 2020. it would be nice to have a simple chart showing when those incentives expire. I assume in the incentives in year one are ready to expire very shortly.
Yep.
And it would just be nice to know what that looks like. And I assume the value of the improvements has appreciated over time also. So I think that would be revealing for us to see just what the value of these incentives are. I'm very interested in the growing the tax base. So that's, I guess, what focuses a couple of those questions. But I am also interested in growing median household income. Do I understand you correctly that household income has increased $7,500 in the past 14 years?
It has.
That would be about 1% per year, 1 to 1.5% per year.
Yeah, I don't have it in front of me right now, but we're on track. You know, our goal is to be, you know, at least in line with the state median household income, and we are we're making fast work of closing that gap. So hopefully in another 2 years, 2 or 3 years, we hopefully will be online with the rest of the state.
I'm sorry, what is our goal?
To be at the minimum at the same median household income as the state of Kansas. So we were quite significantly below that, and we've been making quick work of increasing our household income. So we're
Well, do I understand that our household income is increasing less than the rate of inflation? So how are we making good progress on that?
Well, I guess
so I just wanted to add that so actually median household income has really increased in the last 3 or 4 years substantially, but prior to that it was very slow, as you're pointing out. So that's why we're thinking it's going to catch up soon.
I would probably add to that too, Commissioner. If you look at, we're measuring back against 2010 because that's a census year when they looked at it, I believe, and I'm speaking from memory, but I believe we were like 99th from counties for household income or something like that.
I think it was 103rd.
103rd. Okay.
I think so. Yeah.
About 5 or 6 years ago, we redirected in some of our conversations to make a much more concerted effort toward projects coming in that we would try to influence the salaries. We've done very good for years of always bringing in high-paying jobs, good projects, but many of them we would get less than 20% of the workers coming into our community. And a lot of times it was because we didn't have all our workforce trained to do it. So we focused more toward jobs that our residents can get and achieve. And then we hope they'll be able to achieve and go up to some of our high-paying jobs as well. But as was pointed out by Kathleen, it's really been in the last 3 or 4 years that we started moving the bar significantly in that regard by focus toward these jobs. And we've now advanced to about, Mary, you probably correct me here, 66th, I think, as a county ranking, according to the 2018 census. So
that's correct.
That's one of those things when you look at where we've done. Yeah, if you look at over the 10-year time period, that's not a real high rate of movement. If you look at it over the last 5 years, we have moved significantly, and we keep an eye on that each year to see what we're doing compared to the rest of the state, which is how we're compared when they put out the data.
Well, that's good to hear. That's something that it really is of interest to me. I understand we do have one of the higher job salary, whatever that measure is in the state, one of the top 5 counties in average salaries, but as you say, well down the list in median household income, which as you said, leads you to believe that unfortunately a lot of people are not living in Wyandotte County who have these higher paying jobs. As far as an incentive, I think it would be nice to at least talk about how we could create a situation where we could have more people living in Wyandotte County. I know these TIF projects of residential TIFs have not gone well, but increasing the population would address several of these problems. So it would be nice to talk about that as part of this overall incentive package. Thank you.
Commissioner Philbrook.
Well, I appreciate everything the commissioners have said before me, and they've hit on a lot of really good points. There is a lot of work that has been done through Wyandotte Economic Development that started quite a few years ago on realizing that that we had to change the way we thought about our population and realize that we needed to encourage education and the socialization of those folks, and to realize that they had an opportunity to move up with better jobs and create those pipelines. So that's been going on, and that's been going full steam ahead, and that's been really helpful. And also our folks from the CHIP group who came to Wyandotte Economic Development to try to figure out why we were lagging behind on how we were doing as a population with our health and so on, and why we had such poor reports. And the bottom line is that a lot of folks, there was not a head of household or two folks in the house that had really good paying jobs, and they didn't have good health insurance. And so they were just working themselves to the bone, and there's still quite a few of those folks. But the point being was to work with them, and that group has been doing well too. And I think all of that is part of what has helped over the last few years to bring our household incomes up, you know, with all the jobs we've come, and we really have pinged hard on those companies that have come in and wanted to pay minimum wage and said, no, we really want you to pay, you know, a wage that can let somebody actually pay for a car so they can get to work. You know, you just can't be the supplier of minimum wage employees and expect to come ahead. So all of that, saying all of that, I really want to thank everybody that's been working their little tails off to get to this point, and the fact that I have never seen such a succinct, comprehensive incentive reports on economic development. I actually read the whole thing over today. Don't ask me to quote anything. By the time I got through, my eyes were crossed, and I'm going, OMG, I have learned so much just off of this one report. And I don't know how you guys managed to put it together so well and make it so well organized. And I'm sure the suggestions that other commissioners have made is just going to make it even better. But I'm just in awe. And I just want to thank you guys for this wonderful, wonderful work you've done. So you realize now, as you educate us, that we're going to be asking more questions because we'll understand more what to ask. So thanks again.
Okay, I just want to say that we are under some time constraints. We have two more commissioners who'd like to speak. We would like to get to the priority-based budgeting before the 7 o'clock meeting. Commissioner Burrows.
Thank you, Mayor. I do want to thank staff for their concise report. This is something that the Economic Development Committee members have requested for a while, and it is absolutely to the point as to what incentives we have on the table to bring forward development partners. I also want to state that as we move forward, that we may want to look at how it's not so much dollar driven as it is percentage driven for the pie charts that we were shown, especially dealing with the general obligation bonds. I believe one of the pie charts showed 24% of GOs, but that's a discussion for another day. The success is what we have seen in the community. Reinvestment, rebeautification of our community, and services and or venues that our community members can truly respect and enjoy. And for that, I am extremely grateful. I do believe this information was critical this evening, that we run through it so that the public knows the criteria put forth that we as commissioners look at and staff looks at when it comes to bringing developments to Wyandotte County. It shows that we are doing the prudent homework necessary to ensure that a majority of these projects are successful. And with that, I will close out by saying again, thank you very much, Mr. Bach, for allowing this presentation this evening. Thank you, Catherine and staff, for putting this together. I know the members of the Economic Development Committee are very thankful for this and appreciate your work.
Commissioner Ramirez.
Thank you, Mr. Mayor. My comment will be very quick. I just want to 100% mirror the comments of Commissioner Philbrook. You know, I'm not well versed in economic development and economic development tools, but this report really has given me the ability to better understand all of this. And so I really thank the economic development staff and to you, Ms. Carter, for putting all of this together, because it's really helpful. So thank you very much.
All right, seeing no more hands raised, thank you very much for the presentation. And we do expect it'll get better as the years go by and the numbers get better as well. So let's move on now. Mr. Bach.
Thank you, Mayor. And I'll just say too, I think staff did an excellent job on that report. And we'll continue to make it better and more clear to everyone. The next is feedback coming from our priority-based budgeting. Some of the survey work was done, so we have a quick report. Michael Peterson with our budget office is here tonight to offer that information back to the commission, so we see the results of the information you all work so hard to submit to them. Michael?
Good evening. We are coming back to you today to show you the results of the exercise that we went through after the April 1st retreat. So what we were asked to do, you were given a list of, commission was provided a list of 159 of our non-mandated community programs to rank across all quartiles. So you were tasked to rank whether we should stop the program, examine options for modifying the program, or continuing the program. Each program had a range of 7 to 9 different respondents on the survey. So now we're just going to bring back those results to you. So overall, across the survey, 82% of the responses were to continue the programs that we're currently offering in our community non-mandated program listing, with 9% of the programs receiving a consensus of 50% or more to modify the program, and another 9% of the programs, about 15 each, receiving at least one ranking to stop the program. So the way that we decided to report this back, if anybody ranked at least one vote to stop the program, it's ranked in the red category. If there's a 50% or higher number of respondents that ranked to modify the program, it's ranked in the yellow category. And if there's less than 50% and no votes to stop, it's ranked in the continue program category. And you guys should have we should have provided a handout of what all the programs ranked across the various voting scores. So just to quickly review, yes.
Michael, have you advanced the slides at all?
I advanced it to the one that says the 4 quartiles.
Oh, we're not seeing that. Yeah.
Okay. Let me see if I can share a different way.
There. Thank you.
Okay. Yep. So just to review how the quartiles are assigned, each program was ranked a composite score across all the different strategic goals. And based on its score compared with each other program across the UG, the most aligned would be the quartile 1 programs with the strategic goals. The strongly aligned would be the quartile 2. The lesser aligned programs would be quartile 3, and the programs that are least aligned with our strategic goals would be quartile 4. So in the first quartile, out of the 21 programs that we gave you that were in the quartile 1, 3 programs were ranked stop or modify, with 1 program or 2 programs receiving a vote of stop. That's fixed route transit services and long range planning with urban planning and land use. And senior paratransit had a consensus of modify the program. These 3 programs were identified to have a total of $1 million of budget. In our strongly aligned programs, out of the 67 programs in this category, 89% were voted to continue, 8% were voted to modify, and 3% or 2 programs received a vote of stop. The ones receiving a vote of stop were infrastructure planning and crimes against persons and property, which would be the criminal investigations with the police department. And then the ones that had the consensus vote to modify, or at least 50% of the vote, were patrol activities, shelters and halls with Parks and Rec, engineering with urban planning and land use, neighborhood business and revitalization with the Neighborhood Resource Center, and the Police Athletic League with the police department. These programs totaled about $32.7 million. So the quartile 3, the lesser aligned programs, of the 51 programs, this has a slightly lower percentage of go. The go programs were 82%, with 8% modify and 10% of the programs receiving at least 1 vote to stop. The programs receiving a vote to stop were special populations, res care, dental services, radio amateur civil emergency service team, and hearing aid assistance program. And the programs that received 50% or higher to modify were building assessment program, Christmas program, the parking lots, and marketing with Parks and Rec. And then lastly, of the least aligned programs, we would expect to see a lower percentage here, and we did. So of the 23 programs in this category, 48% were voted to continue, 30% were voted to modify, and 22% had a vote of at least 1 to stop. So the items that were voted to stop: special events with public works, special event support, law library funding, cemetery records and marking, historical collection, record keeping and care, historical search, and community programming and outreach with the historical museum. And then the ones that had the highest percentage to modify were parking control enforcement, painting with public works, and procurement and contract compliance vendor relations. And that is the end of my presentation.
Mayor, I'll just throw out a kind of a quick summary with that as you see the results. Good exercise for the commissioners to go through. I think one thing you did see by that result is Michael would say a vote would go toward a stop. In no cases did we have a majority of the commissioners noting any program should be stopped or taken away. We did see that, though, that there were majorities that would look at things from modifying a program. And I take that to mean as commissioners looked at that, they obviously don't know all the ins and outs of every program that you looked at from the little bit of data that you went through on that information. But it is information that you probably looked at and said, okay, this is the amount of money we're spending here versus the type of thing. Maybe there's some efficiencies or changes, or we should spend a little less money, is how I took that from the professional staff perspective, is what we go back and work on. But it also identifies when you go through that, there's not no real clean programs to say, boy, what are we doing that for? Let's just get rid of it. When 1 or 2 of you at most comes up and says we should stop, that's far from a majority in that regard.
Yeah, I would think most people would understand that we're already really pretty lean. Commissioner Markley?
Thanks. Yeah, I think Doug addressed one of my comments, which was just that I hope other commissioners did, but I definitely put comments in the sections when I said to modify something about sort of what I was thinking, or sort of maybe it wasn't even that I had an idea, but just that I was questioning why we did it this way or why we grouped things a certain way. So I hope those are things that maybe we can circle back around and have discussion about in budget 3-on-3s or whatever circumstances most appropriate. But I think the modify column actually became, for me at least, more of a question column. The other thing I would say is, I mean, my big takeaway from this presentation is really that our data system is at least sort of working. And I say that because you can see that the more aligned programs had less people voting to modify or stop, and the less aligned programs had more. If it had been the opposite, obviously, I think that would have been a big red flag that we were going in the wrong direction and we were not sort of aligning our goals properly with our data gathering here. But I think what you can see from this data is that we are all in the majority, at least, in favor of keeping those programs that are strongly aligned to our goals, and that maybe as you filter down, there's a little more questioning going on. So, you know, I didn't take the survey necessarily as like a, yes, we're going to chop off the arm of some program, but I did see it as a verification that we're gathering data in a way that seems to be matching with our goals appropriately. And I think it was a good check for that.
Okay, thank you for that presentation. And again, this will continue to come back up through the budget process. I think we're ready to conclude our special session just in time. How much time do we need between now and the start of the regular session? 10 minutes?
Yes, we'll need 10 minutes, Mayor.
Okay, so that puts us at, let's say, 7:10. We'll reconvene. Thank you.